Schizophrenia. You hear that word and right away there's so much confusion, so much myth around it, right? But what is it really? And what does the path to recovery actually look like? Well, in this explainer, we're going to cut through all that noise. We'll use insights from the Westminster Clinic to build a really clear picture of the condition and the journey toward a stable, fulfilling life.
Okay, so to really get a handle on the path to recovery, we've got to start at square one. That means separating the facts from all the fiction out there and answering that fundamental question: what is schizophrenia? And maybe even more importantly, what is it not?
So, let's start with a clear medical foundation. Before we can even begin to talk about symptoms or treatment, we need to define what we're actually talking about.
And right off the bat, the experts at Westminster Clinic want us to know something super important. Schizophrenia is not a character flaw. It's a treatable medical condition, and it's rooted in a really complex mix of things: genetics, brain chemistry, the environment. And you know what? That word treatable, that's the most important one. With the right approach, a person's quality of life can be so much better.
And, when it tends to show up is a really big deal. Schizophrenia often emerges just as young people are trying to finish school, or start a career, or build those first big relationships. So you can see how disruptive it can be, hitting at some of the most critical moments in a person's life if it's left untreated.
Okay, let's tackle the biggest myth head-on, because this is a huge one. As you can see right here, schizophrenia is often confused with multiple personalities, but they are not the same thing at all. Schizophrenia is a psychotic disorder, which means it can involve a break from reality. Dissociative identity disorder, on the other hand, is a dissociative disorder. It's a completely separate condition.
Okay, so we've got the what. Now, how does it actually show up? Knowing the signs is the critical next step because, honestly, recognizing them early is the key to getting help.
So here's what to look out for. We're talking about things like hallucinations, hearing voices or seeing things that aren't there, or delusions, which are these really strong beliefs that just aren't based in reality. You might also see someone pulling away from friends and family. Their thoughts might seem jumbled, or they suddenly start struggling with work or school or just getting through the day. And the most crucial point here is that the sooner someone gets treatment, the better the outcomes. It makes a huge difference.
All right, so let's say there's a diagnosis. What happens next? Well, it's not about a single pill or some kind of quick fix. The path forward is really comprehensive, and it's all about restoring stability and function.
You see, effective management is a whole system working together, not just one thing. It usually starts with medication to help get those acute symptoms like hallucinations under control. But that's just the foundation. Then you have therapy, like CBT, which gives people the tools to build coping skills. Psychoeducation is huge, too. It empowers the individual and their family with knowledge. And all of this is supported by a stable lifestyle and getting the family involved. It's a whole network of care.
And this is absolutely key. This is not a set it and forget it kind of thing. A care plan is a living, breathing document. It's constantly being reviewed and tweaked by professionals as the person makes progress. Everybody's journey is unique, so the recovery plan has to be too.
And all of this hard work leads to what I think is the most important part of this whole conversation: the ultimate goal. It's not just about getting symptoms under control. It's about living a full, meaningful life.
This quote from the Westminster Clinic, man, it just says it all, doesn't it? This is the core message of hope. With consistent care, people can manage their symptoms. They can work, they can have fulfilling relationships. This isn't just about survival. It's about the potential to really thrive.
In fact, let's just boil it down to 3 huge goals that are totally within reach with the right treatment and support: living independently, being able to work or go to school, and keeping up those important, fulfilling relationships with family and friends.
So that naturally leads to this next really important question. Recovery isn't a solo mission. The support system, the family, the friends, they play an absolutely vital role. So what can they do to help?
And the answer isn't just, be supportive. It's about real practical things you can actually do. It starts with learning everything you can about the condition, which helps fight stigma. It means encouraging them to stick to their treatment plan, helping them maintain simple daily routines like good sleep and diet, and even participating in family counseling. These are the kinds of concrete steps that can make a world of difference. All right, we've covered a lot. So what's the big takeaway here? What's the one thing you should walk away with?
Look, if there's only one thing you remember from all this, please let it be this: schizophrenia is a treatable medical condition. The goal isn't some magical one-time cure, but a continuous journey, a journey away from chaos and toward stability, toward clarity, and toward a meaningful, independent life.
And that leaves all of us with one final, powerful question to think about. Whether it's for yourself or maybe for someone you care about. What is that first brave step towards stability and recovery? The journey always begins with seeking professional, compassionate help.